Good evening, all, and welcome to another episode of Heart Support Australia's Heart Support Connect. I'm CEO Dr. Christian Vidicchio, and tonight we have a great speaker talking around mental health and the importance of mental health after heart surgery, and that is Mr. David Delaney, who is our guest speaker. His title tonight of the presentation is titled "Mental Health After Heart Surgery: When Does One Feel Better?" In actual fact, he's also a former board member Heart Support Australia for many years ago. And basically, David is also a cardiac consumer himself and resonates very closely to the work that we do here at Heart Support Australia around a consumer-led peer support program. So a basic brief introduction about David is that he is a registered psychologist with APRA, having completed a Master of Psychology, Counselling Psychology. He's also an RN by trade as well. He has decades of experience in mental health education, having worked full-time in the tertiary, university and TAFE levels, developing, managing and teaching mental health units for undergrad nurses at both levels. He's been a registered nurse for over 30 years, specialising in critical care nursing, emergency, ICU, CCU, and he's also been an educator in emergency departments for nursing students. His teaching experiences has also extended to teaching anatomy and physiology to student cardiac technicians, family violence to recruits for the Victoria Police. On a personal side, David has had an aortic valve repair during his teens, after he was diagnosed with congenital heart disease whilst he was an infant. In 2013, David had an aortic valve and a ascending aorta replacement. Due to complications, he required lung surgeries as well. This lived experience has no doubt led to a passion about providing appropriate support to those with congenital heart problems and the importance of what happens post-heart surgeries. David now, as he likes to say, ticks like a clock and hates being on warfarin, especially given he likes to ride a motorbike. So on behalf of Heart Support Australia, welcome, David, and thank you for being our guest speaker tonight. I'm sure those who are online with us or others who will be watching this across our peer support groups or online on our YouTube channel will really much appreciate having a psychologist and nursing input and consumer input around the mental health and following heart surgery. So now over to you, and thank you very much.
Along, if that's okay.
Perfect, go with it.
Let's go with it.
Thanks, David.
No worries. So firstly, thank you for your introduction, Christian. And yeah, in fact, all of those things that Christian said before. I'm an RN, I'm a psychologist, I'm a university educator, but particularly the reason I actually reached out to Heart Support Australia originally was because I'm a survivor of 2 rounds of open heart surgeries. When I was 16, I had my very first surgery way back in the days of the Royal Children's Hospital. And then later on in life, about 10 years ago, I actually had an aortic valve replacement. And my ascending aorta was replaced as well, the big artery that comes out of the heart. There was a big difference in how I felt about the surgeries, to be perfectly honest, how I felt about it when I was 16 and how I feel about it later in life when I was in my mid to late 40s. And I think that makes a difference too about how we go about recovering overall from having a major heart event. Our age does play a role, different aspects in our life, who we are as well during our lifetime, our past history, medical past history, and mental health past history as well. So, but I'll come to that kind of stuff as I'm going along. So I guess part of today, and I'll try and get through as best I can because I'm used to teaching for about an hour. The great Christian's given me half an hour, so I'll try and go as fast as I possibly can. Effectively, the aims of today is really what I wanted to do is just talk a little bit about mental health post-heart surgery, but you could change that and move it across to post any heart event, because a lot of the things we experience post a heart event is very similar to what we experience post-heart surgery anyway. We certainly see some changes in our mood. We often see changes in the way we think, concentrate. Forgetfulness is really common post-heart surgery, post-heart event. And on top of that, we get a different sense of our place in the world, I think, as well. We go through a whole lot of changes after having a heart event because it's something really, I guess we don't prepare ourselves. There's no way to prepare yourself for something like that at the end of the day. And all of a sudden, this thing is thrown on you, and all of a sudden, we've got to try and cope with all these conflicting emotions. Prior to having an event or prior to a surgery, there's lots of anxiety. There's worry about the outcome. Afterwards, there's also anxiety and worry. There's also a sense of low mood, which I'll loosely call depression today. But there's a little bit more to it than that. And there's certainly changes in the way we think. But what I'm going to do as well is suggest some overall direction for support towards the end of the presentation. I'm also going to ask you to just keep in mind a few basic self-care strategies after any heart event, which are good things to look for. On top of that, what to do if the symptoms that you're experiencing, like worry, low mood, forgetfulness, etc., if they just continue on. And I've popped there as well that it's really a unique feeling. For those that have experienced surgery, ICU stays really odd. There's a huge amount of research about the effect on sleep deprivation. When I talk to my university students, for example, I often ask them, what is the purpose of sleep? Why do we actually sleep? And they give me a lot of really cool answers, really great answers. And I must admit, I particularly enjoy turning around and saying, I think you're all actually pretty wrong. And the things they kind of give us are, we sleep to recover, we sleep to recharge, we sleep to, for things to get better for the next day. Overall, we actually don't know why we sleep, but we know that sleep is really, really important. And we know that not having a lot of sleep and good quality sleep, particularly in ICU and being in hospital, it really can affect our mood overall and the way we think in terms of our cognition. So today, I'm going to look at a bit of literature as well, back up stuff I'm talking about with evidence-based stuff. We're going to look a little bit at cognitive changes. If those changes persist, what to do. And then hopefully we get a chance to talk a little bit about lived experience towards the end as well. I think that's nice because a shared experience via lived experience is really, it's really beneficial for a lot of different things. But I think those of us that have experienced a heart event often feel alone and isolated. It's a very hard thing to describe and discuss with family sometimes, though that's a good thing. And this is where groups like Heart Support Australia, and one of the reasons I reached out recently and in years past to be part of this, because as a group of people, we can collectively in some way formulate a level of understanding of what different people are going through. I know for me, one of the biggest changes I had post-surgery was being on a medication I really hate, which is what Christian said earlier, being warfarin. I can't stand it, but after about 10 years, I'm slightly getting used to it. Oftentimes, I hear this term, heart event, and I actually did hours-long research, believe it or not, on this particular thing, like what actually is a heart event. I think overall, this is a great little definition for me. Any term that's used to give us the sense of anything that's a change to our overall cardiovascular system. And so that includes having angina, having a heart attack, or what we call in health an acute myocardial infarction, an AMI, having heart surgery, different types of heart surgeries as well. I've had the valve done, but there's also loads of research and loads of experience to be got from people that have had bypass surgery. Oftentimes, they go hand in hand. The bypass surgery often comes after having the heart event in the first place, or as a thing called a stenting put in. Now, this is one of my bones of contention, so please just forgive me for this. At the end of the day, a lot of people mix up mental health and mental illness, and they they talk a lot about, I've got mental health, as in that's a bad thing. But in actual fact, um, we have good mental health as well. This is the World Health Organization's definition of what mental health actually is. Overall, what it says is it's basically a human right. We all should have, we have a right to have good mental health. They tell you it's an integral part of who we are and what we do. It's a key part of our everyday. When we look at diagnostic stuff in psychology, as in changes to someone's mental health, some of the key things we look for are changes to our emotional state overall, our social world, our occupational world, and our overall level of functioning before we make any attempt to make any form of diagnosis. So they're the key things we kind of look for. Are there any changes in what we call any of those domains? Oop, click. Recovery post any event is different for everybody. It's really, really hard. And I tried really hard to actually put together a bit of a presentation to give us a sense of what we all could look for. I had no idea how many people were going to be here tonight. But everyone's experience is going to be different. There's a reason for that. There's lots of reasons. Family history, what we call comorbidity or other medical conditions, other mental health conditions as well, family supports, other stressors in life, financial stressors as well. For me, post heart surgery, just so happened at that time my wife was she was off work as well, and we had a young child who was, I think he was about 4 or 5 at the time, but maybe even 3 because he was very loud. But being both of us being off work, we actually found really quickly how difficult it was just to pay the bills. And overall, in terms of my recovery, I had worry, I had pain, I had a whole lot of different things going on. Ended up having some complications, which led to me going back and having 3 lung surgeries. And again, the one of the key things I actually remember from all of this is the worry of how my family were going to cope when I'm laying in bed in hospital. So my wife, for example, she struggled a lot with my loudly ticking new valve. We actually do physiologically have a pause every now and then in our heart rate, but you don't know it. And you only know it if you've got a ticking valve because there's a very short gap, or I should say, a bit of a larger gap between when the ticks happen. And routinely, I reckon for about 6 months, my wife would wake up, shake me, for goodness sake, and wake me up and say, "You're okay." And of course, I turned around and said, "Well, yeah, I was asleep." So there's a lot to be said about the family's recovery as well as our own personal recovery after a hard event. Lifelong drugs, all of a sudden, we're plied with a plethora of them, and they're changing. And I can't speak for all of you, but I know that the ongoing blood tests, looking after wounds, being on certain medications, like I said, the one earlier before was warfarin I really didn't like. That really had an impact on me. And being particularly careful about that particular drug because it has a lot of stuff that goes with it in terms of having to be regular with that drug, having a short window of time. There's a lot of fluctuations when you first start on it. And soon enough over time, those fluctuations become less and less as your body kind of begins to tolerate it, if you like. I often say to my students, it's a bit like brake pads just wearing in. At first, they're not quite right in your car, and they might slide a bit, but then they wear in and they seem to be okay after that. I've been on warfarin now for about 10 years, and excuse me, and I still don't like it. And in particular, having those ongoing blood tests. So, what are the most common mental health problems? Anxiety is actually really common. It's generally linked to our own family and our own past history and post-operative worry as well. I'm going to talk about the post-operative worry in a little bit later. Same with forgetfulness and changes in our thought pattern called cognition. And a lot of people experience low mood. I'm going to put depression up there. If any of my uni students say, oh, everyone or people experience depression or this or that, the first thing I say is what type, because there is actually quite a lot of different types of anxiety types and depressive types as well, depression types. However, for the purpose of today, I'll keep it pretty brief and just say overall really painfully low mood. But soon I'm going to show you what sort of things I mean by ongoing low mood. Why do we get them? Overall, there's a lot of research about the time we're on bypass, that there's a link, they call it a correlation between the two. How long we're on bypass for and the prevalence or the amount of people experiencing different types of depressive illness. Ongoing worry is generally linked to anxiety, but when it's ongoing and it doesn't seem to abate for whatever reason, that really also is strongly linked to having symptoms of depression. Post-operatively, and post-event, really, I found, particularly in my nursing career, that people experience this real touch of mortality. All of a sudden, they realize that we're finite. We do end at a particular time. And it kind of hits people, I think, really hard when they've had a heart attack, an AMI, when they've had angina, or after heart surgery as well, because you just get this realization that life doesn't kind of go forever. And I think if I could talk for hours, which I won't, Christian, but I'd love to talk about why that notion that we don't really take a lot of, or we don't give a lot of time to the notion of life being finite and over a set period of time, why that's changed over the years. We have physiological changes, so also a strong link between inflammation post-operatively and mood changes. So mood includes anxiety, depression. We might get clots that flick up from different parts of our body. And again, that's why it's really important to make sure we look after our what we call anticoagulation or blood thinners, like warfarin. That will protect us from those sort of changes. We have this awareness of life is different now after our heart event. But we actually spend a lot of time, particularly after a heart attack, just talking to people that have had a heart attack about key things in life that you should be looking forward to going back to. Being active, being sexually active as well, and all these kind of things, because there's a lot of worry that comes with that. Of course, personal past history has a big impact on the mood changes post-surgery. What sort of things do you look for? So this basically comes from the criteria that we look for in terms of depression from our diagnostic book, our DSM. I'm going to lean over here. Oh, hope my books don't fall over. Our little diagnostic book that we have lying around. There's a bigger version, but it's too expensive for me and I don't want to buy it. So what do we look for in terms of signs of depression? People start getting this notion of things that we used to enjoy in the past. We just have little interest, or when we do them, we don't seem to have the same amount of pleasure that we did before. We often feel down. There's a sense of hopelessness that might come into our lives. And this is over a longer period of time. Not a day-to-day, we all have day-to-day fluctuations, but we start looking at, are these changes over a week or 2 weeks? And do they persist for most days, more than not? People often say they feel tired and have little energy. Conversely, they also say that they're sleeping too much or not enough. Similar with appetite, their appetite might be really poor and they're not eating, or people tend to overeat. Feeling low about bad about yourself, I think that comes into the guilt part as well. So I'll come to that. That you're a failure, you've let yourself down, your family down, even though this is physiologically something that's happened that's way out of your control. For me, I was born with a faulty valve. That valve in my heart should have 3 working parts, one was born with 2. So in the end, it had to be replaced. People move, speak slowly, and oftentimes they have thoughts of dread, like they just feel like, oh, I might be better off if I was not here. And when things are getting really serious and we get to really worry, it's when they think about harming themselves or yeah, in some way. If you see any of these signs, I strongly suggest you talk to someone, obviously, and particularly GPs. GPs are actually these days very, very good at monitoring and assessing mental health changes. How long do they last? The golden question. Oh, if only I had a piece of string. I'd love to do a visual thing. I don't, but overall, I'm going to give the average, what the research says. Things usually resolve after a few months, sometimes after a few weeks, sometimes, but generally speaking, they're a few months long. They may last to about a year. If they're, again, ongoing and they're really impacting your daily life, seek out support and help. We'll talk about that a little bit later. So they can be affected by changes in life, that sense of mortality. Guilt seems to be one I hear of a lot. When I see people who have had any form of health condition, they feel like they're not being the provider anymore. They're not being the supporter of the family. Oftentimes these people are, really key, strong members of the family. And for some reason, they feel like that's the role that's not there anymore. They're not able to do what they think they should be doing. Pain is a big one. I'd love to talk to you about pain for the whole time. Maybe if Christian ever invites me back and I learn how to work a computer better than what I do. Again, you'd think I'd do okay because I actually teach. Nevertheless, ongoing pain can certainly affect your mental health. There is stacks of research and support nowadays around ongoing or what we call chronic pain, and past history comes up. Worry. What can our impact of our mental health post event? And I wanted to come back to the just for a moment the anxiety side as well, or worry side, because all of a sudden we're on these drugs, and it's a big change for me. And I'd love to hear your experiences at some point as well. For me, like sitting back and going to pathology so often, weekly, every few days at the start, and then weekly. I'm down to about monthly, but it goes a bit back and forward. I worry about getting scarring on my arms and the little blood vessels. Goodness, I get the good blood taker today. And frankly, we just don't need that, right? At the end of the day, it's such a big thing. Sometimes part of my day is going off to pathology and trying to organise myself around who is the good blood taker on the day. Worry is about simple things. I ride a motorbike. For years about what would happen if I fall off, and what would be the impact to my family as well as to me. Going out to dinner used to drive me nuts for about the first year or two, because some of the drugs we take are really affected by the diet we have. All of a sudden, we've got this new drug. We have to have this increased awareness. We also almost need to be like a dietitian to really try and figure out what we're eating is okay. Me, one of my favorite foods is Indian cuisine. And I remember even ringing up about, probably close to a year post-operatively, ringing up an Indian restaurant and one of my favorite places, and spoke to this poor person who said, how much coriander is in the food. My goodness, the poor person turned around and said, look, there's a lot. Medications, the list just goes on. You can read these yourselves. Aspirin, antacids, antibiotics, Nurofen, medications for irregular heart rhythms, all sorts of different things can affect them. Food, garlic, ginseng, green tea, which is a favorite of mine, coriander's there. Licorice, for goodness sake, grapefruit. No wonder I'm stressed. No wonder I'm stressed and I worry all the time. Because when I have something to eat during the day, or we're going out that night, or going to visit people, I have to think, oh, I've got to make sure I'm home in time before I take that drug. So there is a strong link between worry, ongoing worry, and what we call anxiety and panic. Brief note about cognitive changes. So cognitive change is just a big word for how we think. Around 50% of people post-heart surgery experience cognitive changes. They might get forgetful. They might struggle overall with concentration. And the best evidence tells us that it's the being on bypass that can really affect us. A lot of research about being sleep deprived. That's one thing I'm very, very interested in. And the changes with sleep deprivation. I'm actually looking at potentially doing research into this area in the future. Oh, I can't spell. Good for me, teaching at uni. Changes overall in mood. And then we have just changes in our body overall. If there's a clot, inflammation, and different things can actually affect our cognitive processes and thinking. How long? How long is, again, a piece of string question. By and large, the research tells us that we return to normal after a few months. But of course, that can really be impacted by ongoing worry, pain, our pre-surgical cells, physically and emotionally. So there's a lot of things to take into consideration. What can I do overall? There's so many things. We could have done the whole half hour on doing mindfulness exercises, relaxation. I could have talked. I have this thing called a sleep hygiene planner for some of my clientele. Ways of getting a good night's sleep.
Do I want so what? No.
Oh, hello, Tracy. Practicing emotional health, setting positive goals, learning to manage ourselves, maintaining realistic expectations about what we can do in that time as we improve and as we recover over a longer period of time. There's a lot of research that says changes and recovery from a heart event can take a year, can take longer. It depends on a lot of factors. So give ourselves realistic expectations about what we can do, and certainly take note. This is a good thing for life overall. Overall, is just celebrating the progress. At the moment, my wife and I are renovating a rental property. Oh my God, what a terrible thing we've got ourselves into. But I've been trying to encourage both of us to see the little wins. Today, we painted a cupboard. How great does that look? The rest of the house is looking terrible, but that cupboard looks great. And that really can have a good impact on our overall mental health. Again, spelling mistake. How bad am I doing? If you have concerns about your mental health after surgery, first things first, talk to your loved ones, talk to your family, because you know what? They will no doubt have seen the change in you. Ask them if they've noticed anything. Tell them how you're feeling. Even that, it's that notion of just talking things through and spreading the load is good overall for our mental health. And certainly reach out to people like myself, GPs, etc. And if you just want to check in, there's no harm in going to a GP or a psychologist for that matter and saying, hey, I just want to check in on my mental health. If I had a perfect world for me, I would love for us all to do some questionnaires about our mental health before we had heart surgery. A bit harder when we have a heart event, like a heart attack, because they're unexpected. But it'd be great to do that questionnaire before and then to do it in intervals afterwards, just to see if there's a bit of a change. We expect there will be. As you've seen from the statistics, there's a high chance there'll be changes in our mood and our thoughts months to up to about 12 months post-operatively. These are the key takeaways for today. Overall, I think probably look for those changes. They're very common. Why am I keep putting changed in? Forget that. changes in cognition and mental health. They are extremely common. One in four overall have a like depressive change, and about half of us after surgery have a real change in our overall concentration levels and forgetfulness, so cognition changes. Look for the signs. It's nice. I hope today you can take away that you've got a bit of an awareness about some things to look for. All this stuff you can easily get online nowadays, the things to look for when you get that sense. And generally people are pretty good at going, I know I'm not myself. I know I'm not feeling great, but I just don't know what's different. If you can have a look online, different places, Beyond Blue has great information online. That's usually my first port of call. After that, there's loads of different organizations as well. That Anxiety Recovery Centre is one. That's very similar to Beyond Blue with other information about the anxiety side of life in terms of mood. Reach out to those around you and to health professionals if you have ongoing concerns. So the nation here is, if after had a heart event and you're feeling not quite right, reach out, have a chat to someone, ask them if they can see a difference. If you're really concerned, go and see somebody about it, and then let them have the opportunity to talk to you and see if maybe there's need for some sort of follow-up. So I have done, Christian gave me 30 minutes to do this, and I've noticed it is 29 minutes and 12 seconds. So good on me. I'm going to stop talking right there and throw you back to Christian.
Perfect. Thank you so much, David. I really appreciate that. If you want to make me the host again, if that's right on your end, that'd be great. You can just hover over my my screen and just assign me host under the Heart Support Australia banner there. I guess whilst you're doing that, it's always important, you know, to kind of ask the questions. And so I don't have any at the moment from anyone's who's here, but that's fine. I guess one of the things I wanted to ask is in relation, you know, a lot of it was focused on your experiences. Because one of the big one here was also on the war front, and a lot of people may look at that. You know, I guess I want to try and bring it back to perhaps people to look at if they're not in that same boat as yours, and everyone is a little bit different. Spoke about how anxiety and depression are typically the two kind of interlinked markers that we see in cardiac disease patients, and I agree with that. The evidence does show that. Would you suggest, in terms of people, you know, who are going through a cardiac journey, some important things to do in terms of reducing some of those anxiety and depression markers? And is it actually easy to do so? I think, I mean, we know we get some interesting, you know, we understand everyone's different. Everyone, you know, I don't have heart disease. I could quote bypasses and ablations and what people expect, but I'm sure the day that if I have to have one, which I hope not, but genetics perhaps say otherwise, I would be scared too, you know, and I would probably have some anxiety and things like that. So, you know, what are some, you know, based on what we're talking about in terms of anxiety and depression, do we see them actually improve quite significantly generally in the patient cohort with heart disease patients?
Yeah, look, again, it's a great question. And it's probably a piece of string question, because there's a lot of different factors that come into play. I think particularly personal past history and past history in terms of mental health and other comorbid medical things as well can play a big role in terms of how people are managing stress, anxiety, the low mood, those sort of things. You asked, are there like simple ways, I guess, of managing, you know, the anxieties and stress during the journey? Yeah. Yeah. No. Look, yeah. Yes and no. Yes and no. If there were, I'd be out of a job, and I like getting paid, so that's not great. But there are some basic things that we should look for, I think, that are going to help us throughout that journey. where do I start? I think one is look after your physical health. There's a huge link between our physical health and our mental health, and our mental health and our physical health. They're bedfellows. They go hand in hand together. Being active, I think, is a really good thing. So being active doesn't necessarily going to the gym, going on Instagram and seeing those crazy people that do ridiculous amounts of weights and different things. Like, I don't even know why they're there, to be perfectly honest. It's more about going for a swim, going for a walk, getting outside, being part of the world outside of home as well. Oftentimes, when we experience some sort of hard event, we feel very alone, I think. It's difficult to explain to other people what that experience is like. And sometimes we don't want to. We feel like, are we putting a burden on other people if we tell them how we're feeling by, going through just trying to convey to people. So then, I think having the opportunity to talk to somebody, you don't necessarily have to see a psychologist. Let's face it, we're expensive. We're excellent, brilliant, all that sort of stuff. We're worth the money. I better put that out there. But and we should get paid more. I'm just saying. But have a chat to someone. I think these sort of things, I really, really, in my heart of hearts, no pun intended, I hope places like Heart Support Australia and the like grow because it's such a nice feeling to be able to sit down with someone that's had a like experience and just spread the load a bit. And sometimes to hear from someone else's experience, do you know what you want to hear sometimes? Is it going to be okay?
Mm.
And just to hear from someone that's gone through the experience, it's, I'm not allowed to swear on Heart Support Australia's webcasting thing. I wish I could, but it is really valuable hearing that sort of stuff. Just even seeing some people sometimes, when they come in and they're with you and you're going, you went through something I've been through. Hey, I think I'm going to be okay. That's a nice, really nice feeling. So overall, I think probably in short form, look for the signs of things not going right. The key takeaways for me usually is the first things that change are diet changes. People are starting to eat too much, not enough. They don't care about their diet as much. They might go, oh, look, I just couldn't be bothered eating today. Oh, there's a sign, right? Look for that sort of stuff. Look for those changes. Changes in personal care, how we care about ourselves, I think is really important as well. Because they're like, I've got a fear of spiders. They're like the spiders that just creep along the roof, right? They're just there. And I think some of these changes, like, hopefully it's not a spider up there, it's fluff. But, they just creep along. All of a sudden, these things creep in. We're not looking after ourselves in doing what we can, like looking after our self-care, looking after our physical health, going for walks, being active, being social is a really nice thing as well. I used to work for a company called Panda, a helpline for people who are going through perinatal journey, and people having that experience to be able to talk to other people that have gone through similar things is really cool. One I'm going to come back to is, yep. Go on, Bob.
Look, I agree with you 100% on that. I'm Bob Sterling. I run a peer support group here in Canberra, and I've been volunteering in the hospital for 13 years. Had surgery in 2009. But look, it's the peer support group is where we really get to, help people out. And the number of people, one of the best sessions I ever did, I walked in, I said, I've got absolutely nothing planned. Today, I would just like to talk about what's going on up here. Everybody happy?
Yep.
And it was one of the best sessions we've ever had because everybody trusted each other and everybody just opened up and it was magic. And the fact that I've been treated for depression myself, on and off for several years. But when I do rehab talks, mention the possibility of depression and the fact that you've just got to accept and just get some help if it comes. And men are the worst and the women tend to look for help, but the men don't. And it was my daughters who turned around to me and said, we think you might be depressed. I said, no, I'm fine. They said, no, idiot, you're not. Go and get help. I did. It worked. So I really appreciate the fact that we're focusing here on the mental side of it, because to me, that's one of the biggest issues we've got. So thank you.
Oh,
No,
you're
thank you,
welcome, Bob. Yeah.
Any other questions? Any from anyone? I see perhaps there are some people on the chat coming through. So look, I think something from Lauren. How can people access peer support via, if they don't live in the cities they run? Look, with Heart Support Australia, we do run a face-to-face program around peer support, and it's really based on what David has spoken about today. And as a former clinician and myself in the space, or I'm still an active, I guess, researcher as well, but the realities is, we always typically focus on the interventions. We always typically focus on perhaps the hardcore science. And then, we might call this the soft stuff, but actually it's the things that we don't think about. And you can have a new heart, you can have a new stent and really rock and roll. But when you kind of get thrown back into the wild, let's say, it can be a lonely journey, and there's no one around you and things like that. So, peer support does really help people understand that you're not the only one that can kind of, maneuver through that. In saying that, our peer support groups are unique. So we run them face to face. We have nearly 30 locations nationally now. So if you go on our website, at heartsupport.org.au, you should be able to find all the information there where our peer support groups are, and also we're currently which hospitals we're active in across the country, and where we're actually providing some bedside support as well. If there isn't anything near you, especially around a peer support group, and you're looking for something, you are welcome to, we are a volunteer-based organisation. You can reach out to us and we could have a discussion with you, perhaps in terms of setting up a group locally in your area if you feel that there's a need, or perhaps if you don't feel comfortable perhaps leading a group, you're welcome to start a discussion with us, and maybe you can put us through to some local stakeholders who would be really worthwhile to speak to, who could help us get a group started. Namely, probably would always say maybe it'd be like the local hospital or cardiac rehab service would probably be the major ones. If you don't have something like that, perhaps an allied health community service or things like that that do some type of things associated with that. So feel free to go onto our website or reach out, and we can take that offline. That's not a problem. Other than that, David, on behalf of Heart Support, thank you for your insightful talk, around the mental health aspects associated with heart disease, and obviously for your own personal experiences as well. We appreciate it. We understand that, your story will resonate with many people who are watching this, whether it's tonight or if it's in one of our peer support groups, where we typically show these videos again throughout our peer support group leaders. So on behalf of Heart Support Australia, thank you again. And we look forward to keeping in touch, and we'll go from there.
Yeah, look, thanks again for having me. Could I just say before you go, the one thing I really, really, really push on people is getting a good night's sleep. There's nothing better than getting a good night's sleep, but gee, we make it so hard for ourselves.
I have
Look
two
at Christian.
kids, so I have a
Look at you.
3-year-old and a 1-year-old. So that quite isn't happening at the moment.
Man,
so
come on.
I wish that was the case, but quite not possible over here. But anyways, thank you again. I really appreciate it. And you have a nice night. And look, for everyone out there also, our next session will be on Tuesday, the 21st of May. Again, we do that on 7 p.m. Eastern Standard Time, which will be it will be Eastern Standard Time, not Eastern Daylight Time, because daylight savings will be finished. And we have a great speaker talking about Dr. Georgia Chasseling. She'll be talking about heat and heart health, and some of the evidence and data coming around that as well. So we look forward to that one. And on behalf of Heart Support Australia, David, thank you again, and all the very best, and we'll keep in touch. Take care.
Thank you so
Bye-bye.
much. Bye all.